Welcome back to the second half of this session on management of common dental diseases. To discuss this topic, we have with us Dr. P.N. Mehra on my extreme right and Dr. Mandira Kapoor ma'am. And we have covered in the previous session about the development of teeth and the various types of teeth and functions of the oral cavity, oral health issues, and what are the risk factors which are impacting our oral health. And to continue with that topic, I would like to again ask about we have to emphasize upon the risk factors again, because you are dealing in the community, and if you are not able to identify the risk factors, then it is not easy to give them any health education or make them aware. So it is very important to know about various risk factors, then only you will be able to even do the screening. So I would like to emphasize upon the risk factors again, sir.
So the risk factors are uh, tobacco usage, tobacco consumption, use of alcohol, physical inactivity, and unhealthy diets. And oral diseases are also non-communicable diseases, just like the other non-communicable diseases which we know about, like cardiovascular disease or diabetes or cancer or chronic respiratory disease. And then two conditions like our mental conditions and injuries. So, apart from these risk factors, there are certain social determinants in oral health which are also very strong. Social determinants means like people who are uneducated or who have not much awareness about oral health. They are the people in whom we will find a very poor oral hygiene, or people who are from a lower socio-economic background, or who follow certain cultures and customs where there is not much awareness regarding the oral health. Then there are certain common dental conditions which you need to be aware about. First is dental caries and early childhood caries. You can even see in the pics. The first pic shows a child with having rampant, it is known as rampant caries. Very commonly, it is seen in children who are put onto a nursing bottle, especially at night. The mothers put a feeding bottle in the children's mouth and they let it be there all night through. And milk also has this sugar, the lactose, which acts on the teeth and it leads to caries. Then periodontal diseases, that means the periodontal tissues getting involved. Then you have dental erosion, which could be due to extrinsic and intrinsic factors, dental attrition, that is wearing away of the teeth, dental abrasion, malocclusion, where the teeth are not aligned or occluded in a normal manner, and lastly, you have oral cancer and potentially malignant disorders. Then there could be wisdom tooth related problems. Normally, our ancestors used to have wisdom tooth erupted well. That time they used to chew on a much more hard and a fibrous diet. With evolution and as the dietary patterns are changing, now the wisdom tooth has also become kind of a vestigial organ, just like the appendix in the body, and therefore the jaw size has decreased and there is not much space to accommodate the wisdom tooth. So we find that the wisdom tooth is either embedded in the bone, or it is partially erupted, or it is not erupted at all. Then we will be talking about dental fluorosis, orodental trauma, congenital defects, and the oral manifestation of systemic diseases. Now, the first and foremost is dental caries, or also known as tooth decay or cavity. When does this happen? This is, we all have a layer of plaque. And what is plaque? It's the thin layer of the food particles mixed with bacteria and some saliva, which gets accumulated onto our teeth. As it accumulates on the teeth, the bacteria act on it and they produce an acid. And this acid, which is produced by the bacteria, causes the demineralization of the enamel. It eats up onto the enamel, creating a cavity, and that is known as dental caries. So the cavities occur when the bacteria and the plaque, they metabolize the dietary sugar to make an acid. The acid demineralizes the tooth and it creates a cavity. Cavities can happen on any surface of the tooth. And our saliva only acts as a natural defense to help repair the enamel. Now, these are the stages of the tooth decay. We can see in the first picture, the caries has affected the outermost layer, that is the enamel. So, it's known as the enamel caries. And slowly, if it is left untreated, it progresses to involve the dentine, that is the dentine caries. And then slowly and slowly, the pulp is getting involved, and this leads to a condition which is called pulpitis, and it is also painful. And lastly, it affects the periodontium, causing an abscess, and that condition is called as periodontitis. So there are further risk factors which increase the likelihood of tooth decay. Bacteria, then family history of cavities. Family history again, like I explained to you earlier, it means whatever the dietary regimes have been passed on to us from our elders. The diet consuming excesses of sugary foods and drinks, inadequate fluoride, a low saliva or dry mouth from many prescription drugs, then low socioeconomic status, which includes a poor diet or lack of access to oral health care, aging, disease, and treatment can contribute to the risk for tooth decay in the adults. Then the signs and symptoms of dental caries are, it begins with sensitivity to cold, hot, sweet, or acidic foods. There could be pain while chewing food. A spontaneous pain may occur in advanced stage even without chewing. There could be a loss of tooth structure, and there could be a halitosis, that means a foul smell from the mouth, which could be result of food lodgement and cavities. So how can we avoid getting cavities? Firstly, we should avoid sugary or sticky foods or snacks, and should choose nutritious fruits and vegetables and cheese over the fast food. We should avoid drinking soda and other sugary drinks. Drink more of milk, water. We should avoid snacking all day long and limit the amount of snacks that you have to have throughout the day. And also, when we are eating anything sweet or sugary, we should try to eat it before our meal, and that should not be the last thing before we eat, apart from having to clean our mouth and oral tissues after every meal. For preventing tooth decay, dental sealants are used. These are a protective plastic coating which are applied on the chewing surfaces of our molar teeth, where decay often starts. They protect the grooves within the teeth from bacteria which causes cavity. Then systemic fluoride, which is found in the tap water, and this strengthens our bones and teeth and prevents tooth decay. Early childhood caries, like I explained to you earlier also. So these refers to as atypical, progressive, or acute or rampant pattern of caries, in which all the front teeth, upper and lower of the child, mostly the upper front teeth, are involved. Now, the treatment of dental caries is removing the decay by cleaning up the tooth and restoring it with filling materials like a silver filling, a gold inlay, composite resin, a glass enamel cement, a full metal, or a porcelain crown. And in advanced cases where pulp could be involved, then endodontic treatment or a root canal treatment may be required. In a periodontal gum disease, the healthy teeth have a healthy gums and bones surrounding them. But in case of a periodontal disease, the same teeth have unhealthy gums as well as bones which surround them. So all periodontal diseases also, they start from this plaque. And what is it? It's a soft, sticky bacterial deposit which forms on the exposed surfaces of the teeth. How can we remove it? By brushing and flossing. What happens to it is, when does it become hard? Because it calcifies over time. This plaque layer keeps on depositing on our teeth. It keeps getting calcified, and the more it gets calcified, the more difficult it begins to remove it. So then it becomes into tartar, which only can be removed by the dental surgeon or the dental hygienist by using special instruments and machines. So plaque results in a local inflammatory reaction which is known as gingivitis, and if left untreated, it leads to a periodontal disease. Now, periodontal diseases can have two causes: the local causes that can include a poor oral hygiene, improper brushing and flossing techniques. There could also be systemic causes like pregnancy and adolescent stages with hormonal variations, or diabetes mellitus and other immunocompromised states, cigarette smoking, etc. Then periodontal diseases could be due to direct causes, the indirect causes, as well as some distant causes. These are a few signs and symptoms of periodontal diseases. The first feature would be a red or swollen gums, tender and bleeding gums. There would be food lodgement in between the teeth causing an itchy sensation, and there would be a difficulty and pain in chewing, loose teeth, sensitive teeth, receding gums, and calculus and tartar deposits, stains on teeth, and on a dental x-ray you would find bone loss.
So what I find like these sign and symptom which are listed, if the student knows these sign and symptom, they can simply observe the oral cavity and they can find out and ask even the patient whether yes or no. They can get the answer in yes or no for all these question, as well as they can observe also bleeding and swelling and these things. So it is easy if you know the list of these sign and symptom, then you can easily identify this as in the screening or during the routine checkup or during your NCD clinic. You can identify these symptoms. Yes, ma'am. Can carry on, ma'am.
So there are a few factors which increase the risk of the gum disease. So firstly is smoking, because it interferes with the healing. Then hormonal changes in girls and women. Hormonal changes take place during pregnancy, during menopause, and using birth control can also make the gum tissue more susceptible to gum disease. So while taking history also, one can ask the female patients whether are they pregnant or they are in the menopause or are they on birth control pills. Then diabetes, this increases the risk for many infections including gum disease. And there could be other illnesses like AIDS, HIV, cancer and treatments as well. Then we come to another condition known as dental erosion. This erosion is caused by a direct contact between the tooth surface and the acidic substances. Now these acidic substances could be extrinsic or intrinsic. Mostly the acids in the mouth originate from three main sources. Firstly, the acid which is produced by the acidogenic bacteria. Then we may ingest the extrinsic acids in the form of dietary components like acidic foods and drinks. And intrinsic acids are those which result due to regurgitation, that is the backflow of the gastric contents. The acids which are of bacterial origin, they cause the caries, but the extrinsic and intrinsic acids, they cause dental erosion. This picture shows dental erosion. The signs and symptoms are there is discoloration of the teeth, there are dents in the teeth, and there is severe tooth sensitivity. The patient will complain of tooth sensitivity. What is dental attrition? It is a type of a tooth wear which is caused by a tooth-to-tooth contact, and that results in the loss of tooth tissue, normally the enamel, and it starts at either the incisal or the occlusal surfaces. And normally it is a physiological process and commonly seen as a part of aging. That is physiological, but in pathological, dental attrition could be caused by bruxism. What is bruxism? It is a habit which is some people have a habit of clenching teeth or grinding of teeth, which causes attrition. Now this is a figure which shows how the teeth have got attritioned. Their height has decreased, and probably this patient is a bruxer, that is he either grinding or clenching his teeth. So there is a loss of tooth anatomy, and the patient may complain of pain or sensitivity. There might be tooth discoloration, and because of the loss of tooth anatomy, there is also altered occlusion as the height has decreased. Then we come to a condition known as dental abrasion. What is dental abrasion? It's the loss of tooth structure by mechanical forces or from a foreign element. And the cause could be due to wrong toothbrushing, excessive use of toothpicks, floss, or any dental appliance which is frequently set in and removed from the mouth. So in this figure, you can see that near the gingival margins of the teeth, there is an abrasion. There is loss of tooth anatomy, and there is the patient complains of sensitivity and pain. This typical type of an abrasion has been caused by faulty brushing, and it results also in a cavity known as a class 5 cavity. And almost the if the patients are brushing in a wrong manner, that is, they are doing horizontal brushing, it causes the wearing away of the enamel, resulting in these cavities. So somewhere down the line, we have to understand that a proper brushing technique is also very important. If you know it properly, only then you can guide to your patients how to be brushing properly. So you have to be brushing by holding the brush at an angle to the cemento enamel junction and brush vertically. That is, the strokes have to be up and down and not horizontal strokes. The previous slide where I showed you, can we have the previous slide? These cavities have resulted because the person who is using a brush is almost doing horizontal brushing. Just like we polish our shoes, that way he's been using the same kind of movements on the teeth and has resulted in cavities. Then we come to malocclusion. As the name suggests, mal and occlusion, that means occlusion which is not proper, which is a misaligned. It is an incorrect relation between the teeth of the two dental arches as they approach each other when the jaws are closing. In the figure you can see where the teeth are maloccluded, even cleaning of the teeth becomes an issue. There could be a dental arch discrepancy, or there could be a craniofacial anomalies. The signs and symptoms would be you would find a crowding of the teeth, or even there could be a skeletal disharmony. Then we come to dental fluorosis. That is the intrinsic staining of teeth due to the presence of excessive fluoride in the diet, especially the drinking water during the formative stages of the teeth. The dental fluorosis could be due to a direct exposure where the levels of fluoride are more than 1 parts per million of fluoride in drinking water, or it could be indirect, that is where there is a tropical climate and there is excessive ingestion of water and beverages which have a high fluoride content. Or it could be a distant cause, which could be due to a poor nutritional status deficiency of vitamin D, calcium and phosphates. So this pic shows dental fluorosis, also known as mottling, where it shows in the form of white patches and loss of the enamel translucency. And in advanced cases, there could be brown spots on teeth, and further advanced cases could also show skeletal changes due to excessive fluoride. So, as I told you earlier, our mouth is the mirror of our systemic health. And almost half of the people, like this example shows, who are HIV positive have oral, fungal, bacterial or viral infections. And these occur very early in the course of the HIV infection. Here in this slide, you have a number that is an IVRS helpline number 1800112032. The earlier numbers you must have seen, they are all these numbers of helpline numbers, but the last last four digits are very important, 2032, because 20 represents the number of the deciduous teeth that we have, that were 20 in number, and 32 represents the permanent teeth that we have. So that is why it is this helpline number. Please do dial and try this. This will be a guide to how to what to do in various kind of oral health diseases or oral conditions.
So this number is all throughout India, and
Yes.
anybody can access
Yes,
through this
yes.
number. And what all information they will get from this number?
Regarding various dental conditions, what one needs to do, what are the signs and symptoms, and how one can go about in treatment
Very
of
good.
those.
Yes, it's very good. Students, you must try it. Yes, please carry on.
Now, there are a few signs and symptoms of many systemic diseases which first manifest themselves in the prodromal phase in the mouth. Like, for example, in measles, you will find the Koplik spots. In diabetes, you will find the patient having severe periodontal disease. In pregnancy, there will be gingivitis or a pregnancy tumor. In a cardiovascular condition, again, a patient will always be suffering with a periodontal disease. If a patient is HIV infected, there would be hairy leukoplakia. And if there is a celiac disease, then there would be dental erosion. Now, I hand over the mic to Dr. Pravesh Mehra to take
thank
forward.
you. Thank you, Dr. Mandara. I think you've made my task very easy by defining the various conditions of the oral cavity, and I'll do justice to this to students as some other diseases also are there, which could be wisdom tooth related problems. Now, wisdom tooth we understand is the third molar, which normally we have two upper and two lower, as Dr. Mandara told you about, but they're vestigial organs and not important in the body as these days, and we have normally in people around either physiological or pathological impaction is occurring, as you see in that X-ray, where the four wisdom tooth are impacted in the jaw bones. The various signs or symptoms of wisdom tooth problems that you might come across is basically pain, swelling, and inability to open the mouth. In these conditions, antibiotics are not required when there is simple pericoronitis and only pain, and simple use of some antiseptics, mouthwash, and brushing properly with some hot saline rinses. I think that will reduce the symptoms and signs for the impacted tooth pericoronitis. But if the patient has severe infection and there is swelling and of course some pyrexia or fever, then of course he requires some help with some antibiotics and other measures of a healthcare professional. The other thing is orodental trauma. It's very common to find injuries to the oral cavity, and roughly, as I told you, around 60 to 40% of children in the age group of 6 to 12 years are affected by dental trauma because of various unsafe playgrounds, unsafe schools. It could be road traffic accidents also, and violence also, which results in hard and soft tissue injuries to the oral tissues. Now, in these cases, either the patient would have severe pain or inability to bite or not to open his mouth open or wide. There could be some bleeding to the oral, nasal, or ENT bleeds, or a deformity of the face, and there you require the help of a oral healthcare professional. But if the tooth is dislodged or the tooth is dislocated from its socket, then of course that tooth can be reimplanted by a dental or oral professional, provided you get that tooth within a time of half an hour to his clinic, and you should get it not in water, but you should get it in milk or saliva or in the socket back again. The only thing you need to prevent this from, just hold the tooth by the white structure, as we told you about the crown part, and wash in water and bring it in milk or in saliva to the oral professional. The other, we all know about oral cancer. Now, oral cancer is a very important issue. Why? In our country especially, because the awareness regarding oral cancer is very less, especially tobacco usage, which causes oral cancer. And this cancer can be diagnosed in an early stage. That is a potentially malignant disorder where it is not cancer, but the symptoms are similar to cancer, and subsequently these lesions or conditions might convert into cancer. So if you can diagnose that at an OPMD or oral potentially malignant disorder stage, then the early diagnosis can help us in screening these patients and preventing cancer from coming in a major way and causing a problem with our health statistics of the country. The various risk factors for cancer we all know about. Tobacco being a major risk factor, and we have to counsel our patients to take a no tobacco initiative or stop tobacco consumption in every way. So we can already, you've gone through this book where we talked about direct, indirect, and distant causes for tobacco, for oral cancer and oral potentially malignant disorders, with signs and symptoms, where we talked about sores, any sore in the oral cavity, a spot in the lump, or rough and crusted area, or numbness in the area, or bleeding, or neck lymph nodes, which would be symptoms or signs for oral cancer to there. But of course, some white patch or red patch or a ulcer which is not healing for the last 2 weeks, I think these are major issues with oral potentially malignant disorders, and we should try to prevent them from converting into cancer. The other part is the congenital defects. These are birth acquired defects, and we need to identify, because you see it affects the psychology of the parents when they see a child with a cleft lip and palate being born there, and I think it's a evil onto the family. But these are not such, and they can be treated immediately at a young age. Of course, surgeries would be required, not one but a couple of them, to treat these patients and bring them to give a decent life in their, when they grow up and they go to school and they become into adults also. So what is the role of healthcare professionals in prevention? We've already covered this in your book chapter. I think it has all medical interventions where you prescribe some drugs, or could be some fluorides where you put 1 ppm fluoride drinking water, or aspirated fish or sealants, have preventive aids, non-medical interventions where you try to provide proper nutrition and use protective gears for sports injuries and other interventions where you provide an accessible and affordable healthcare or healthcare to the population. Similarly, periodontal disease, these also can be prevented by simple medical intervention, non-medical and other interventions as we have covered in your books. Fluorosis also can be prevented by using the primary prevention, the secondary prevention and the tertiary prevention approaches as we have mentioned in your books of chapter. The prevention of other tooth problems, especially malocclusions, should be actually diagnosed and referred to oral health centers. But the main thing would be for restoration of the missing or the permanent teeth, or to with the help of dentures, or the making the diet with a sugar-free diet, or preferring children to chew a sugar-free chewing gum, and providing at least drinking water of 1 ppm to the families. The other part about prevention management regarding oral cancer and pre-cancer would be again medical interventions we covered, and non-medical and other interventions where we talk about self-examination of the oral cavity in a major way. So everyone should be taught when you are in the healthcare clinics that who are a high risk category of using tobacco and alcohol, I think they should be taught about self-examination of the oral cavity so that they come immediately when they get the first signs of a white patch or a red patch or a mouth which is limited and you cannot open properly, or an ulcer, as I said, which is not healing for the last 2 weeks. So these need to be diagnosed by the patient himself. And we've seen when it is done as a good screening measure for oral cancer be detecting at an early age. We all know about health effects of tobacco when we talk about early deaths, to cancers, to cardiovascular disease, to low birth weight infants, to aging and skin. And these are the various tobacco uses in the country. And latest we've seen hookah bars coming up in malls and cities, and e-cigarettes, which is being banned but still being used by the population these days. We talked about the risk approach, common risk factor approach for various diseases of NCD, including oral health, and tobacco being a major, because tobacco kills. It does not make you suffer, but it kills you directly. It is like a bomb into the community. But you see, for the health ministry, for us also, it's a major public health problem. But for the other ministries, if you look at the agriculture ministry, the commerce ministry, or the labor ministry, this is either a livelihood or a revenue or a crop for those ministry. And that is why it's very difficult to ban tobacco in our country. But we can do a awareness among the community for tobacco use and preventing from oral cancer to come in a major way. What we talked about was preventive measures for oral cancer, and these should be, as I said, diagnosed at an early age, at an early stage by self-oral examination we talked about, and tobacco cessation be made a major part in counseling our patients to quit tobacco. But the gold standard for any cancer to be diagnosed remains biopsy, either the incisional, the excisional, or the punch biopsy by the oral healthcare professional, or any, for the matter, the ENT colleagues or surgical colleagues. For the management part, as we talked about, for any measure of the oral diseases, including cancer, the prevention is certainly better than cure. And for cancer to be managed, we require either surgery, or radiotherapy, or chemotherapy, or a combination. Or if it is spread out totally, then palliative care approach is a must. And the big concept, the wow concept we talk about, the cancer. If you see the right part of it, the invasive cancer has come in. Now it's very difficult to save these patients. There will be 90% mortality, morbidity, whatever you may do, whatever centers you might create, high centers. But if you can diagnose these cancer at an early age, at the stage of cell mutation or hyperplasia, and provide treatment, or a dysplasia stage, or an in situ stage, I think the morbidity and mortality can be decreased to a certain extent, and a life mortality will decrease to at least more than 50%. We can decrease that. The 5 steps for preventing oral diseases, as we talked about, should be either to brush your teeth twice a day, morning and night, floss your teeth at least once a day, say no to tobacco or any form of tobacco, and eat a healthy diet, as well as maintain regular checkups with a dental surgeon at least twice in a year, or at least once in a year, as we say. So brushing, at least 2 to 3 minutes, and we said twice a day, use a soft junior brush, use a pea-sized amount of toothpaste to brush your teeth. Dr. Mandaras told you, don't use the horizontal strokes, do the vertical up and down independently, and always supervise children when you brush your teeth. In the dietary part, avoid frequent snacking, sipping of sugary beverages, and drink plenty of water, and of course do not snack every day. Behavior wise, limit alcohol including sugar-free chewing gum, perform self-oral examination, and avoid tobacco in any form. With this all, I think we can achieve a greater oral health in our community in the times to come. The other part is basically what I would like to say is about prevention is better than cure. And the 5 takeaways from our talk is basically oral health is connected to your general health, and oral health can affect one's quality of life. A tooth decay is a chronic issue which can be prevented, and prevention includes maintaining good oral hygiene, healthy lifestyles, and we should support our community by providing oral health resources. And thank you so much, everybody, for joining us. That's the number that Dr. Mandara was talking about, 1800-11-2032. 1800 means a toll-free number, 11 a daily region number, which is you don't pay any money for this telephone number, and 2032 20 32 as we say, 20 the milk set of teeth and 32 the permanent set of teeth. With this, I thank Dr. Rita and her team at IGNOU for inviting us over and sharing our views. And we would be always eager to come back and be with our students and to exchange our knowledge and values with you all.
Yes, sir. I think the student must have gained out of this session. It was a very effective session, and I thank Dr. Mehra and Madam Mehra for joining with us and giving their inputs on the topic. Thank you very much.
Thank you so
Thank
much.
you.
Are you a fresh graduate? Do you want to fulfill your educational aspiration by pursuing higher education in various interdisciplinary and multidisciplinary areas?